So when you pair them together, well, let me ask you that most peptides can't be taken orally because of bioavailability. When your stomach's going to break down the peptide, BPC is one of those that you can take orally. Can you take TB orally, and would it be beneficial for any reason?
I am not aware of anyone taking TB orally. It's probably got a very poor bioavailability. Any oral preparations I know for gut, and we will do a segment on gut because there's lorazepam. Those all do have oral preparations, but I never see TB in it. So BPC orally, yes, to some degree, but that doesn't mean just because it doesn't work, don't try injectable for yourself before you give up on it. But TB prepared orally.
So then TB is more systemic. You're going to take that.
You take them both subcutaneous.
Yeah.
The way you do TB, because it is more systemic, you can do all 5 mgs in one shot.
Okay.
Whereas BPC, we usually definitely recommend 500 mics every day.
Daily,
if you can stand that.
Yeah.
If you can't, you can still do your 5 mgs once a week, 3.5 to 5 mgs once a week, but it is better to technically get about 500 mics to a mig in a day, or do like a 5-day on, 2 off type thing, and get 1 mig as you go and then take 2 days off, just because of the way they work. But technically speaking, if you're just deathly afraid of injections, but you want to go the injectable route, you could do 1 a week, I think, and still get a lot of benefit.
Okay. So with those two, so far we've talked about acute injuries, healing, gut inflammation, chronic use injuries, overall systemic inflammation. Let's go into GHK-Cu because I don't really know a whole lot about that one, to be totally honest. GHK, I forget what that stands for. The Cu is copper.
Yeah.
So technically you can get them separately, or I don't even know if maybe it started that way and now it's just
GHK-Cu. It's one product, and it is a copper peptide, and it's really, many people look at it as on the anti-aging spectrum, but we're covering it today because of the way it works. So it works on collagen, actin within your skin, and that's going to help skin repair and regenerate. So anti-aging benefit. It also can help if you've got a little bit of hair thinning, it can bring it back. So like, if we have women with PCOS, GHK-Cu is great. If we have women who maybe started HRT and dosing just didn't agree with them, and you get a little bit of shedding, we can use GHK-Cu. We'll fill it back out. But it also can be used like after surgery. Like if you want to minimize scarring and heal quicker, it's going to heal that tissue and that skin faster. So that's why you do see it sometimes paired with those other 2 we talked about, called glow, because it's going to make your skin look better. You're pulling inflammation down. So you're doing all these great things for your body. You're repairing quicker. You're pulling inflammation. Your skin's getting more collagen synthesis. That's where I think the glow term came from. Fine to
together. GHK-Cu, I can't imagine that'd be available oral.
I think I've seen one product that has it oral, but I do injectable.
Yeah.
I don't believe that's
Yeah, it would be useful. Injectable, is that a site-specific kind of thing?
It is subcutaneous. They're all subcutaneous. It can be done really anywhere. I always tell people to rotate. I don't like being near my belly button. Let people start there, and I think it's very painful. I like being more near my groin or up in my hips, finding the skin there, and just going with all my peptides. But rotate your sites. But yeah, that's a sub-Q. Usually about a mig and a half, 2 mig is your sweet spot. 3 to 5 times a week. Start there. Women should notice finer lines over time, but I know a lot of women love it. Hair should look youthful and more shine, and we've seen women who are trying to regrow their eyelashes thicker. It works for that. Hair, skin, nails is your GHK-Cu, but again, I put it under repair, and with the other 2, not only because it is done that way with the glow peptide stack, but because we can combine it in surgery situations, and it does lower inflammation as well. That again will help your healing process. Anything that has a collagen base to it that you need to repair, that's going to improve too.
Pretty much everything in the body.
That's why these kind of all 3 work beautifully together. If you just had a knee surgery and you got the funds, you put all 3 of those together, you're going to heal fast without having that surgery done.